Hi, everyone. Welcome back to the podcast. Welcome all new listeners and welcome back to those who have heard my content in the past. If you want to know 4 things that I no longer use in clinical practice, you have to tune into this episode. Hi, everyone. Welcome back to the podcast. Welcome all new listeners and welcome back to those who have heard my content in the past. If you want to know 4 things that I no longer use in clinical practice, you have to tune into this episode. Before I go on to the podcast, what is new with life? What is new, greater, bigger, better, upgraded in life? Life is actually fantastic. My cap, if you haven't heard my podcast ever, I'm healing from a recent calf injury that is better. It's about like 92.7% better, but it is coming along. Training is going well. I am excited. This last week, if you ask me, where are you spending most of your time? Recently, the last week, I have been putting all my energy into planning for my next upcoming course, the Sports PT Kickstarter, which I will tell you later down with the podcast. But everything has been going into that. All my team is ready to launch the darn thing. Family is good. I have a growing family, and all of my kids are, if you know me and what I represent, I like to make very logical, calculated decisions in my life. And the downside to that is that my kids see that and they're now approaching me logically when I tell them things to do. So they're giving me options and plan A's and plan B and plan C. And now they're telling me like it's hard as a parent because you want to teach them to be greater than you, or like really disciplined. And when they watch you and see what you do, it backfires sometimes. So excited to see that and fighting that currently. All right, on to this podcast. What is happening? I want to share some things as I grow as clinician. I want to share with them with you so you don't have to make those mistakes. And one of the things, like, why am I doing this podcast? Because I had a recent conversation with a physical therapist I mentor. Like, what they asked, what are you doing after 14 years of practice? What would you say that you're no longer doing that you were doing either earlier in your career or throughout your career that you maybe wished you wouldn't have done so much or focused on? And so I had to come up with the 4 basic things, and they're actually really, really straightforward. And for a lot of clinicians, this could be very actionable for you. This is like a really good take home. And for some of you, you're going to hear it and be like, oh, I understand 1 or 2 of these. But ultimately, if you can get these 4 things down, you're going to be skyrocketing. And what I mean by that is you're going to change your framework. I'm not going to teach you an exercise. It's not what I'm about. I think you can learn an exercise on Instagram. That's not a problem. But what you really need to do is improve your framework on how you approach people. Like, what's your structure? What's your foundation? What's your plan? How aggressive or conservative are you? So that's what I'm going to give you today. So I'll start with the first one. All right. Number one. Uh, I don't think this comes as a surprise if you've been in my world for a while. I don't rely on measurements as an indicator of progress. Now, it depends on your setting, right? So whether you're traditional insurance based, you're cash based, you work in collegiate sports, you work in elite level sports, whatever your world is, right? Now, what I mean by this is like the GONI is important, right? Any form of measurement is important. I get that, right? How much rotation have you gotten better? Yeah, whatever. I focus less on my measurements, like my week to week measurements, as my indicator of progress, right? And a lot of us were taught in PT school, like, you have to use that, right? It's insurance. We have to know the progress. And so there's a lot of patients and athletes who want to know, like, am I that much better? And what I really had to do was come back a little bit and look at function, right? Like, I understand your knee flexion has gone from 27 degrees to 130 degrees. Good for you, Mrs. Jones. But you still can't walk up and down stairs. And that to them is important. Now, if you're making post-op progress, great, makes sense. If you're going like, oh, I gained 15 degrees from the last session, that's huge. But when you talk about non-operative pain and progress, like, that person really doesn't care about 20 degrees. They really care about, like, can I sleep at night? Can I sit on the chair? Can I go up and down stairs? Can I play with my kids? And can I go to the gym? That's all they care about. So I use their functions and percentages on how close they are to their function versus their day-to-day or week-to-week measurements. So what I mean by that is I haven't been able to pass, like, my knee hasn't been I have a painful knee every time I bend it past 90 degrees. Great. When does it bother you? In the gym. Great. With what? Squatting. With load or without load? With load. How much load? 135 pounds. Great. How many reps? 15 reps, 3 times a week. Three times 15 reps, 3 times a week. Great. How many of that were you able to do? 0. Great. So next time I see you, I'm going to take this Goni and throw it out the door, and I'm going to ask you for the next 3 weeks, we're going to measure your progress on how many times you can been able to squat at a increasing load. Well, I was able to do 1 set this week. Great. Beautiful. How many days a week on the next set? Next week, I got 1 set twice a week. Great. And the last week, guess what? I got 2 sets on the first day. It was a little achy, but I was happy. On that second day, I actually got a set and I was actually near pain-free. Great, now we're making progress. So I can rely on that Goni, but it doesn't translate to function. So like the purists in the world are like, well, how do you know if there's exact progress? And what if the insurance? Sounds good. I'm just saying use a hybrid. I'm trying to shift you away from that pain model and get into something a little more practical that actually today's athletes, your patients, your athletes are smarter than ever. They're more analytical. They're more aware. They've got Google. They got Instagram. They know what progress is, and they can find it somewhere else. If you're going to be like hung up on this one thing, like was it 2.75 degrees or was it 4.3? Who cares? Throw it out the window. What you need to do is focus on what is important on this planet, which is getting people better, not their range of motion better. Now, if it's post-up, I get it. Now, if you want to use the hybrid, great. Shift your focus towards function and what can they do better, because it'll keep your lens, keep your awareness where it's the most important and on the human. Can they do more things they were able to do before they came in? Not do they have more degrees, but still no progress in what they're trying to do. So number one, I don't use range of motion measurements as an indicator of progress. Is probably the best way I should describe that. Function is my current thing now. Now, I still use a hybrid when needed to. If I have a super analytical person who is like a Googler, they have Googled every single thing. They've gone to 4 other physical therapists and they're like hung up on these 5 degrees that they're trying to get. Okay, I'll do that. But I'm also focused on the function. Okay. All right. Number 2, I don't chase pain subjectively or objectively. Hi, Mr. Robinson. You're having pain today. Yes. How much of the pain? 5 out of 10. Great. Next session. How much better? No, 5 out of 10. 5 out of 10. 5 out of 10. 5 out of 10. And they just no progress, right? Or you chase the thing during a subjective evaluation. Well, was this? And does it move with this? Great. Or you try and chase it during a treatment session, which is worse. You're like, oh, you treat them, get them sitting up. Was that better? No. Let me try it again. And then you keep chasing it. Worst thing you can do. You don't want to chase the thing that is most affected by their brain. What you want to do is go towards the things that are moving them in the direction that you have to show them. Pain will always be there. For some people, they just have this input that is always on. And no matter what you do, that light switch has always been turned on and the light, like the actual device, has been removed. That thing is always going to be on. So pain might always be there for some people. I've learned that. Professional athletes, youth athletes, I've dealt with complex cases. Youth athletes who have complex regional pain syndrome. Youth athletes who have addiction to pain meds. Yes, that happens. Pro athletes who have fear avoidance. It doesn't matter. Humans are humans. Doesn't matter the profile or the setting. You have to understand, if you rely on that, you're going to get stuck. And this is all for the young clinicians, established clinicians who are so focused in on chasing this thing. If you do, you're setting yourself up and you're setting your patients and athletes up for failure. You got to move away from the pain. I get it. You have to document it. Cool. Love that. 5 out of 10, 5 out of 10, 5 out of 10. No progress. However, functionally, they're doing better. Here's why. They're able to turn left and right. They can drive for 2 hours with less pain or without irritation or exacerbations or whatever it is. You got to be creative. Get yourself out of the funk. You use that as your default. That's the reality of it. Like that's your one card that you bring up to the patient. It's the one card you use for insurance companies. Get away from it. Use it. However, you got to back it up with facts. What else are they doing? And if you can't find a way, that's your creativity. That's the problem. You rely on it because you're not creative. You haven't found another way to work around the system. You got to get them to figure out what they're doing better. And that's just better questions, better framing. There's so much to the interaction. But what you're doing is you're relying on a piece of paper to dictate what you should be looking for. False. You should create your own system. And this is going into my number 3. But you don't have to rely on pain. Don't chase it. Stop it. Every time you ask for pain, don't treat somebody, get them up, and then see if they have less pain. Facts, that's a comparable sign. I get it. But what you don't need to be doing is using that as the only thing that you're measuring. Stop it. Imagine you didn't have a goniometer, and imagine if you didn't rely on pain as your main 2 things. What would that do? For most PTs, that's your whole arsenal. What would I do? I don't know. Try it. Try it. Try treating somebody for 6 sessions without using those 2 things. I get it, insurance, but don't use it as your main thing. Use it, document it, and throw it out the window, and now focus on everything else you can. Those are my top 2 things right off the top. Get away from the pain. And number 2, stop using your range of motion measurements as the only form of improvement. Stop it. All right. Number 3, I don't let patients' weekly progress stray away from my plan. So what I mean by that is you got to create a target first. What's the plan that you're trying to get this person to? To be able to ascend and descend the 12 flights of stairs because they're a firefighter and they have to be able to do this for work with 20 pounds or 30 pounds of equipment on top of them. Got it. That's the plan. By 12 weeks, I need to have no knee pain or back pain when they do 12 flights of stairs. Great. If the patient or athlete comes to you at week 3 and they're like, oh, I still can't do it. You're like, oh, it's okay. Well, let's back it off this week. No, the plan is generally I have these amount of weeks. We're going to get you there. Now I have to have a little bit of wiggle room, but I'm not going to just retract all of my plans because you're not getting the exact progress I need. I'm going to make adjustments, but I got to have that plan in place. If not, they're not going to achieve it. You're almost giving in. They don't know any better. You're the artist. You're the one painting the picture. You're the one setting the plan and the roadmap. They just got to follow it. And if you don't have a roadmap, you're just going day to day, week to week, making zero progress based on hope. And you're just using actually time as your way of getting something better. That actually is the worst thing you can do because there's a lot of people on this planet, physicians, other people who truly believe that time is the thing that is going to heal people, not physical therapy. You want to make a difference? Create the roadmap and make people get better faster. Stop using week-to-week progress if they're not making progress and you just completely wipe out things. Stop it. Make a plan and have a little bit of bumpers, a little bit of leeway so they can do it. Well, you can't get up 3 flights. That's okay. How about we work towards those 2 and build endurance and strength on top of that? Great. We'll keep you at 2, but we got to double up if in the near future. We got to make a little bit more quicker progress. You just have to know, don't let your patients and athletes stray away largely from the plan. If they're making progress, just not the rate you want, then adjust it accordingly. But you have to know your target. And then week to week, what are your estimated progress ratios to get there? Don't let them stray away too much. I've had way too many patients and athletes do this to me. And they controlled my plan. That's the problem. I let them walk all over me. I did it in the pros, and I learned as a clinician, as you get older and older, one of the best things you do is you actually get learned when you have more control, when you can make the adjustments. And that's what a good coach does, actually. That's what a good coach does on a soccer field, on a basketball court, whatever it is. They know the athlete just needs a little push here. I know they can get to that point. So you push them a little bit. Why? Because you've seen it before. And so if you let the athlete control it, they're going to walk all over you. You're going to be an 0-7 team, or they're like a losing season is because you let them control you. You are the person who's there to support them. That's your job. It's not your job to let them walk all over you and they control it. They don't know any better. You're the clinician. You set the roadmap. You're there to help support them. Don't let them control it, because if they do, you're actually doing them a disservice. All right. Number 4. Oh, is an interesting one. I don't give more than 2 exercises as part of a home program. That's going to be pissing people off. I don't give more than 2 exercises. Rare, maybe an occasional 3, 10% of the time. Unless, caveat, unless they have a sound strength conditioning program. That's a whole different ball game. I'm talking about like a true strength program, not a glorified home exercise program that you just thought of 37 exercises and they're 10 to 15 reps, and it's just basically a rehab program, and you call it a strength program. That's not what I'm talking about. I'm talking about a corrective exercise program, 2 exercises. Why? Because it helps compliance. And you may be like, well, they need strength, they need range of motion. Great. Focus on that for 2 weeks and then go on to the next phase. If you haven't thought this out properly, you're not going to be able to get all that in the same timeline. You can't do strength, endurance, balance, cardio, strength, and plyometrics. You can't progress all of them in the same timeline. Impossible. They all require different inputs to that central nervous system. The central nervous can be fried. They're going to be like all over the place. Person's not going to make progress. They're going to be tired more than anything else. You're going to have to do this systematically. So build endurance for 2 to 4 weeks. Then you can build some strength on top of that. Then you can go, transition into plyometrics. And then once you have that, you can work on speed. But you can't do all of them in the same time and expect all of them to improve at the same rate. So you have to do it calculated in phases. So when I'm doing corrective exercises, that's not part of the main program. The main program is, are we doing aerobic base? Are we doing endurance base? Are we doing strength base? Great. That is my foundation. My home exercise program are there to complement all the things that I need in between there. So when I talk about home exercise program, I'm only talking about corrective exercises too. Why? Because it increases the compliance. That's all I need to focus. On the background, I do have a strength and conditioning program that is 45 minutes, 3 to 5 times a week based on their goals, chunked by the phase that they're in. Hypertrophy, endurance, strength, that is programmed. Don't come to me saying, well, I give way more exercises. Great, but do you have a foundation of strength and conditioning underneath that? No, I was just giving exercise. Great, they're not going to do it. I mean, you might have 20% of those patients and athletes do it, but I'm going for 80%. I'm going for the people who are going to keep motivated and make the progress and outcomes that I know are possible. By giving too much, you're failing. You're giving them too much. They're not going to do it. You wouldn't even do it. I'm telling you. 14 years of practice, simplify your world. 2 corrective exercises, supported with a solid strength and conditioning program underneath. So why am I doing this? Is because I know that you guys can expedite your career path within sports. I just think that you're hearing and reading a lot and getting all this input. And if you're not changing, making those adaptations, you're not really growing, you're just learning. There's a big difference between the two. Let me repeat that. If you're taking all this, you're doing my podcast, you're doing social media, you're listening to audiobooks, you're on podcast, you're reading books, you're doing all this stuff. That's a lot of input. Think about that. That's the same as corrective exercises. If you're doing 5 modes of input and you're only implementing one, why not just do 1 or 2? So that way you're implementing way more. That's called efficiency. That's what your patients and athletes need. They don't need 6 exercises because they're only picking their top 2 anyways. So give them the 2 and be honest with them and get 100% compliance. That's more efficient. So when people say, well, Chris, what do you read? What do you learn? I'm like 1 or 2 things and just let me like zone in and make it productive so I can implement that thing. That's called growth. So when you listen to things and you implement them, that's the difference between learning and growing. Learning is just taking in. Growth is actually implementing. So what are you? Are you growing or learning? You have to understand that. And so the more I see people learning, just taking in input, I'm like, that's great, but you're not moving forward. And the people who need to move forward are the ones who just need to do less and do those fewer things much better. And that's what I'm saying. As I've grown in clinical practice, I do less and I zone in and just hit it hard. I'm telling you, in clinical practice, your first 3 years, you're just trying to take in everything. Let me just digest everything. The problem is you're just implementing only a certain portion of that. You're probably only implementing 20%. So what I'm saying is, why don't you just digest 20 and implement 100%? A little more efficient. Just a little bit food for thought as you grow as a clinician. If I'm mentoring you and you're asking me, hey, Chris, what's next? I would say this is an easy framework. It's everything I tell my team, my staff, my team, all the PTs I mentor, make it simple. And yes, you might not be able to it's tempting to pay attention to all the stuff that's out there. I'm just saying, pick your top 2 things every single quarter, every single 3 months, revisit. So it's the thing I do with my staff. Every 3 months, we revisit what their big challenges are. Is it acute injury management? Is it injury prevention? Is it strength conditioning? Is it sports rehab? Is it post-operative care? Whatever it is, then get in and laser focus on that for the next 3 months. Once you come back to me and you're like, hey, that was great. What do I need to do next? Great, let's reassess that. And so you're doing this chunked approach to growth. for the right people, it works tremendously. And I'm telling you, give that a chance. And that's why I want to share this podcast today. And so, as I approach my upcoming course, which I promise I'll tell you guys more, this is what I'm realizing. That's what people ask, why did you build this course that you did? It's an 8-week online mentorship course, live with me, 2 hours a week, not on the weekends, not on the weekends. It's during the week. I think I committed to Wednesdays from 5 to 7, and you're with me and I'm just coaching you through all these things. I'm going through all the segments of sports PT, 8 weeks of it. It's 2 online modules. We go on Zoom, hang out, go over the courses, give you a little kick in the pants, make sure that you're on the right track. I'll give you all the information that you need. And then your goal is to implement every single week. So by the 8 weeks, you're actually growing, not just doing a CEU course that you forgot in 2 days. I'm here to make change. That's why I'm approaching this course very differently. You asked, I'm giving you it. And it's all based on the feedback that I've been hearing, that you take normal 2-day courses, you forget it by Monday, you have no mentorship, so you rely on one course a week, one course a year to make your clinical growth. False. So a lot of you are walking around there without mentorship, without guidance and support, and you rely on podcasts and audiobooks and Instagram to give you everything when you're not even implement. The problem is you're eating too much content and you're delivering and implementing very little of it. So I'm here to reframe it and give you a different perspective. And outdated CEU courses, I'm here to change the game and I'm here to help you. And that's why I built the course. Sorry, I'm going on a rant because I'm passionate about what I do. And all this feedback is based on all the feedback that I've gotten from every single person that I mentor. And it's because, like, gosh, I wish I'd have learned that sooner. I'm giving it to you now. So whether you're a new grad, you're a tired PT, frustrated with, I've done the CEU course, I don't know where to go. Should I do a residency? Should I not? I'm tired of doing this. I have a family. I can't travel. Great. I built it for you, the modern day physical therapist, to be able to help you grow. So that's my Sports PT Kickstarter. That starts January 11th, 2023, whenever you're listening back to this. And if it's past that time, that's fine. Join me on the next one. Either way, I'm here to help you, and I'm excited to do that because I'm passionate. I love it. I'm going to be here doing this thing, and I'm here to help you along that journey. So wherever you are, sorry if you're new to my world, sorry, that's just what I love doing. So I hope that helps wherever you are in your clinical practice. I will catch you guys on the next episode. Take care.